My name is Yesenia Martinez. For my creative project for the Medical Humanities, I chose to do a video. My video is a series of short interviews. I went out into the community. I wanted to get a real perspective of what the community thought that the physician-patient relationship should look like. I also wanted to get an understanding of what they thought that patient suffering meant. And the following are my findings.
From personal experience, my relationship with my doctors has always been open and honest and trusting, and I think on the part of the physician they should be warm, receptive, and non-judgmental, and on the part of the patient they should be willing to talk about anything with their doctors, because that's what they're there for. So I guess in general, I think the physician-patient relationship should be one of trust and honesty, and there's just no point in, keeping a doctor or anyone if they don't, if you don't trust them.
I really feel like the most important factor in a patient-physician relationship is compassion and understanding. Those are the two biggest things that really can change a relationship and can change a patient from seeking help. If the patient is suffering, they're already vulnerable and, may or may not want to seek medical help. But if they come in contact with a physician who is compassionate and understanding and hearing the patient out, that can make all the difference in a patient following medical directions and seeking other medical help and abiding by the directions that the doctor implements.
Hi, I think that a good doctor-patient relationship should involve respect, communication, trust, rapport, mindfulness, and being aware of the cultural differences and traditions. Many of us come from different countries and speak different languages, and it's very vulnerable and also frightening sometimes to just try and explain to someone whom we don't know what is it that we are feeling or what is it that our bodies are going through. So having a doctor that is respectful and present and really listening to our concerns, it's really helpful and reassuring for me as a patient. A good experience that I've had in the past is a doctor going out of her way, taking the time to explain to me what the root cause of a problem that I had in the past was, and she also showed me natural ways of treating it and handling it and preventing it from happening again. She didn't prescribe medication, which I really appreciate.
When I see a patient suffering, what is the first thing that comes to my mind? And the first thing that comes to my mind is that I hate seeing people suffer, and what can I do to help others?
When I think about patient suffering, it's not just about what they went through or what they have done. It's about what they feel inside and how they are outside. In my experience, my sister got run over, and even though she was the one with me and everything, I felt bad because no one knew how she felt inside, even though people would see what she was inside, but no one cared about what I felt inside, because I was mentally suffering, even though I didn't suffer the accident. I saw everything, and it caused me to feel depression and emotional, and I pushed my sister in a different way that no one else perceived her.
In conclusion, after conducting my short interviews within my community, I have come to realize that the medical humanities is a really important field of study, especially for those of us who want to become medical professionals. As the future of medicine, we have to come to realize that the current biomedical model of modern medicine has dehumanizing tendencies, especially when we think about the physician-patient relationship. It's affected by this biomedical model where the physician only thinks of the tests that need to be run or the prescription that needs to be prescribed, but they don't take the time to actually get to know the patient, talk to the patient, ask the patient how they're feeling, or anything else that needs to be asked in order to build a rapport with that patient. And also, when we talk about patient suffering, we don't realize that the patient doesn't not only suffer from the sickness or disease or illness that is currently happening. No, they also suffer more deeply than that. A sickness can bring on depression. It can bring on so many other symptoms that our current biomedical model doesn't let us realize. So in conclusion, I feel that the humanities, especially medical humanities, is essential to be taught at medical schools.